Hello, my name is Colin Mock, and today I'd like to present to you how AI is aiding cancer detection. So first off, I want to go over why it's important. As we know, cancer is one of the leading causes of death worldwide, with a projected 35 million cases by 2050, with the chances of survival of late-stage cancer are very slim. But detecting cancer early significantly increases the chance of survival, which is why I'm looking at how AI is impacting cancer detection. For AI, it has the ability to really look at large data sets and analyze patterns and make decisions based off those. People such as doctors and researchers aren't physically able to go over all of the mass amounts of medical data that we have. And through analyzing all these data points, we can advance screening, diagnose more accurately, and even make drug discoveries that can help aid in cancer treatment. As you can see here, this is the timeline of how AI has been advancing throughout the years through machine learning, deep learning, and now recently large language models. With, as you can see here in the image, we have a lot of basically medical records such as X-rays, health records, blood tests, and from there we input these into AI models where they can then analyze the data and help us help people. And for my study specifically, I've been looking at how we can predict pancreatic cancer. Pancreatic cancer is one of the cancers that is the most fatal and also is the hardest to detect. I looked at this paper called A Deep Learning Algorithm to Predict the Risk of Pancreatic Cancer from Disease Trajectories by David Placido. Pancreatic cancer, as we know, is extremely deadly. 80% of pancreatic cancer patients are diagnosed too late with a survival rate of 2 to 9% at 5 years. The goal of this paper by David has been to improve the ability to design programs for patients at elevated risks and potentially benefit lifespan by early detection. As you can see here, it basically goes over the model on how it's trained. So basically, it's trained on about 80% of the data we're given, and from there we pass it through a neural network through machine learning, and it's basically used to minimize the error. And from there, we then put it inside of the test set, which then gets trained on that. And from there, we can identify who's got high risk patient and who is a low risk. And with high risk, we need to survey them, like keep them under a close eye to really know, if they might develop it. And then from there, as you can see, we have a whole treatment plan, and it's basically broken into times of 3 months, 6 months, and 9 months. And these are some of the results. So the AUROC, which is basically the percentage, and this basically means that there's an 87.9% chance that the model will assign a higher risk score to someone who is going to develop cancer. And with the relative risk being 104.7, this means that it's 104 more likely to occur in the exposed group compared to the unexposed group. So this could be revolutionary for people who really do need that surveillance and need that close eye due to, genetic factors and other factors. And as you can see from these curves, it's really accurate. But some limitations do arise. So basically, there's a limitation because all of the healthcare systems worldwide aren't the same. There are differences in transferability and differences in clinical practices, such as frequency of recording diseases or typical thresholds for people who are seeking medical attention. In addition to that, there's billing constraints and other billing optimizations that look different in every single country. For example, in the Danish hospital, it was trained on the Danish hospital database, but when transferred to the United States Veteran Hospital database, it had a lower performance. So, this is something that can be accounted for and something that needs to be addressed. But for the successful model, we can first for start with identification of the high-risk patients. And then second, we will then detect cancer through surveillance of the high-risk patients. And then after we've detected, who has cancer, we will then do an effective treatment after detection. And next, what does this mean for the future? So as we know, AI is only getting better with companies like OpenAI pushing for advancements and with data only getting richer. Along with that, we are looking to shift from late stage approaches such as chemotherapy to early stage cancer management, such as, less harsh drugs and less harsh treatments. In addition, with these advancements, we're really looking for early risk grouping to become feasible. As I said, identifying those groups who are basically in need of surveillance and in need of more monitoring. And that's it for me. These are my citations. This is my peer-reviewed study, and this is the study I based my research on: deep learning algorithms to break pancreatic cancer. And thank you.